And now, Wellness Wednesday, brought to you by Dr. K.
Well, Dr. Kira Tolson of Dental Care of Baltimore joins us for another Wellness Wednesday.
Hey, and good morning to you, Doc.
Good morning.
So we're talking about something very important, Oral Cancer Awareness Month.
Yes.
Tell us about oral cancer. How prominent, how prevalent is it?
Yes, so oral cancer describes a group of cancers that impacts anywhere in the oral cavity, so the lips, the tongue, the palate. And about 60,000 Americans will be diagnosed with oral cancer just this year alone.
Oh, wow.
And of those who receive a new diagnosis, only about 40% will survive the next 5 years.
Wow.
So there's a pretty high death rate associated with oral cancer relative to some other cancers.
And what are the causes or predeterminants of it?
Yeah, I'm glad you asked that. So some risk factors that we see are, one, smoking. So smoking is a huge risk factor. Age, so historically people over 40, we're seeing more in young people now because of vaping. So a lot of young people think that vaping is less harmful than smoking, but when it comes to oral cancer, it definitely increases the risk. And HPV, the human papillomavirus, which is a very common sexually transmitted disease, is a big risk factor as well.
Okay, detection, how do you know if you have it, if you feel like you may need to be screened for it?
So the reason why that death rate is high is because most people who get diagnosed are diagnosed too late. Because it typically doesn't present with pain. And so most people in the early phases of the disease, they have no idea that they have it. But it's not hard to diagnose for a dentist. So that's why those regular dental exams are important. We're not just looking for cavities. Every patient that comes into our office gets an oral cancer screen as well. And so it's very easy to diagnose. And if diagnosed early, it's easy to treat and improves your outlook for survival.
Yeah, what does treatment look like?
So there's different forms of treatment, just like any other cancer. I mean, radiation, you can have surgical treatment. But again, treating early is the key.
You talked about smoking being one, vaping, like chaw, chew, that kind of stuff down in your gum. Any tobacco product is what you're basically saying.
Yes, any tobacco products, again, vaping, cigarettes, cigars, any tobacco product will increase your chance for oral cancer. Alcohol consumption is also a big risk factor, and tobacco and alcohol together really significantly increases your risk for oral cancer. And also sun exposure. I think most people are now, you know, hip and aware of wearing sunscreen, but a lot of people miss their lips. So putting sunscreen on your lips when you're out in the sun is important as well.
I miss my lips. Yes. Oh, I didn't know that. Okay, good to know. Once again, how can people get a hold of you and your office?
Sure. So you can reach me at the office. Our phone number is 443-258-9939. You can also visit my website, drkiratolson.com. Also wanted to let everybody know that there is an oral cancer, DMV Oral Cancer Walk, April 26th. So increase the awareness, protect yourself, raise money, come on out, have fun, support the Oral Cancer Foundation.
The 26th, where is it?
It's in Silver Spring.
Okay,
yeah,
it's not too
little
far
drive away.
Okay, because put on your lip balm and come out and see you.
Yes.
Go out and walk. Dr. Kira Tolson, thank you so much.
Thanks for having me.